How to prove sleep apnea secondary to hypertension. If you're a veteran struggling with sleep apnea and hypertension, you might be wondering how to prove that your sleep apnea is connected to your hypertension for VA benefits. Let's break it down step by step. First, you need a clear medical diagnosis of both hypertension and sleep apnea from a qualified healthcare provider. This diagnosis is the foundation of your claim, so make sure it's accurate and documented. Next, you have to establish a medical nexus, a link between your service-connected hypertension and your sleep apnea. This is where a nexus letter from your doctor comes in handy. The letter should explain how your hypertension has caused or aggravated your sleep apnea, backed by relevant medical research and your specific medical history. For example, studies have shown that long-term hypertension can contribute to sleep apnea by affecting respiratory and cardiovascular health. Your doctor should state that they believe your sleep apnea is at least as likely as not caused by your hypertension. In addition to the Nexus letter, you need consistent and comprehensive medical records. These records should show the progression and treatment of both your hypertension and sleep apnea. This includes any sleep studies you've undergone, as a sleep study is critical in diagnosing sleep apnea and showing evidence of irregular breathing and other signs of the condition. Medical articles from reputable sources can also serve as evidence to support the causal relationship between sleep apnea and hypertension. For instance, research has shown that obstructive sleep apnea can lead to increased blood pressure due to the repeated episodes of oxygen deprivation during sleep, which triggers the body's stress response. When filing your claim, you'll need to submit VA Form 21-526EZ, along with all your supporting medical documentation and the Nexus letter. Ensuring that all these pieces of evidence are in order will help you build a strong case. Remember, the VA rates sleep apnea secondary to hypertension based on the severity of your symptoms and whether you require a breathing device like a CPAP machine. The ratings can be 0%, 30%, 50%, or 100%, so accurate documentation is key to getting the right rating. By following these steps and gathering the necessary evidence, you can effectively prove that your sleep apnea is secondary to your hypertension and increase your chances of getting the VA benefits you deserve.